Asslam-o-Alaikum everyone, and welcome back to my YouTube channel. If you are new to my channel, then subscribe to it and press the bell icon for the latest updates. Without wasting your time, let's start. Today, I will discuss another drug of CNS, that is phenytoin. Before discussing, we know about what is CNS and CNS drugs? The CNS is the processing center of the body and consists of the brain and the spinal cord. It is such a system that controls most of the body functions. And CNS drugs means the drugs that stimulate or depress the CNS, known as stimulants and depressants respectively. Now I will discuss the origin of the phenytoin. What is the source of phenytoin? Origin. In 1908, phenytoin 5,5-diphenylhydantoin was first synthesized as a barbiturate derivative in Germany by Professor Heinrich Biltz, 1865 to 1943, and subsequently resynthesized by an American chemist of the pharmaceutical company Parke-Davis in 1923 in Detroit. A recent study shows that phenytoin drug is also obtained from Catharanthus roseus plant, commonly known as bright eyes, Cape periwinkle, graveyard plant, Madagascar periwinkle, old maid, pink periwinkle, rose periwinkle, is a species of flowering plant in the family Apocynaceae. Dosage forms of phenytoin: tablets, capsules, syrups, injection. Mechanism of action. Phenytoin stabilizes neuronal membranes and decreases seizure activity by increasing efflux or decreasing influx of sodium ions across cell membranes in the motor cortex during generation of nerve impulses. It also prolongs effective refractory period and suppresses ventricular pacemaker automaticity, shortens action potential in the heart. Side effects: central nervous system, insomnia, sleeping disturbance, headache, drowsiness, suicidal ideation. Cardiovascular system: hypotension, decreased blood pressure, cardiac conduction disturbance, depression, cardiac arrhythmia, irregular heartbeat. Gastrointestinal, GIT. Vomiting, diarrhea, nausea, swelling of lips, hyperplasia, enlargement of organ. Dermatologic: dermatitis, inflammation of skin. Skin rash, skin and tissue necrosis, death of body tissue. Endocrine and metabolic: deficiency of vitamin D. Local: injection site reaction, purple glove syndrome, edema, discoloration, and pain distal to injection site. Neuromuscular and skeletal: osteomalacia, softening of bone due to vitamin D deficiency. Ophthalmic: nystagmus, circular motion of the eyes. Indication: phenytoin is an anti-epileptic drug used in the treatment of epilepsy. Drug interactions: phenytoin decreases the effect of many other drugs when it is taken with phenytoin, like albendazole, acetaminophen, ozole derivatives, antifungal agents, amiodarone, etc. Phenytoin increases the effect of many other drugs when it is taken with phenytoin, like chloramphenicol, clarithromycin, doxorcalciferol, vitamin K antagonist, etc. Warning and contraindications. This is contraindicated in hypersensitivity to phenytoin, simultaneously use with delaverdine, bradycardia, decrease in heartbeat. General considerations: do not change brands or dosage forms of phenytoin without first checking with your doctor. Different products may not work the same way. If you refill your medicine and it looks different, check with your pharmacist. Swallow the tablet whole or chew it thoroughly before swallowing it together with a glass of water. Tests: if patient take phenytoin, then he should perform the following tests: blood urea nitrogen and creatinine test to check kidney function. Liver function tests. Glucose test to measure your blood sugar, because phenytoin can cause your blood sugar to rise. Blood tests to measure the sodium level in your blood. Commonly prescribed brands. Tablet epilantin 100 mg. Injection Epigran 250 mg. Dose: 300 to 400 mg in 1 to 2 divided doses.